This is my third and final video in my video series regarding my extended inquiry project and the question of what is the function and significance of pain tolerance. In the last video, I went over the historical view of pain tolerance in regards to its cultural role, and I looked at how genetics play a part in pain tolerance along with disorders regarding pain. In this video, we will be analyzing the original evolutionary reason for pain and pain tolerance, the biological processes behind pain, and fields that deal with pain and pain tolerance. To begin, I'll discuss why humans evolved the ability to feel pain originally and why pain tolerance became important. Humans, for the majority of our existence, have been hunter-gatherers. The lifestyle of these humans was extremely harsh and physically demanding, essentially being based around the idea of kill or be killed. This idea applied particularly to hunting, where humans would go after animals to kill them, collect their meat, and sustain themselves, along with their groups and families. Some animals that were hunted were quite large and, in a life-or-death scenario during hunting, would fight back. Additionally, some of these animals had body parts that could be used as weapons, such as claws. Humans would often be injured in these hunting skirmishes, and if not dealt with, bad wounds could lead to death. Over time, through evolutionary selection shown through the principle of survival of the fittest, it led humans to develop pain, a sensation triggered by brain signals that tell the body that what is happening to it isn't good and needs to be avoided and or addressed. The notion that pain is a mechanism that came about is further substantiated in the academic article, Evolution of Mechanisms and Behavior Important for Pain, when it says, however, plausible arguments also suggest that evolution selected mechanisms in diverse species that can persistently maintain pain-related hypervigilance as adaptations to especially dangerous environments and to enhance vulnerability persisting long after disfiguring injury. The quote is stating that evolution took a liking to the trait of being able to be more reactive and alert due to pain, and to the trait of being more vulnerable and wary of danger long after getting pain from an injury. Essentially, as time progressed, humans with the ability to feel pain and respond to it survived, and that trait spread in the gene pool. This is why it is such a developed sensation with humans today. In regards to pain tolerance specifically, it came about from people needing to endure more pain, whether it be through societal pressures, physical endeavors, or frequent exposure to pain. Some people developed a greater ability to tolerate pain. An example of this would be the gladiators in Rome. They conditioned their minds, bodies, and nerves to block out the pain to fight for their lives. Another perspective to look at is daily activities. Someone who lives in the Sahara and walks on the hot sand all day or carries large loads will be more resistant to pain because they simply endure pain all the time and are used to it. Now on to the topic of the biological processes behind pain. Pain is a response to trauma or biological disturbances. Its purpose is to protect the body from the harm that is happening to it. The process of feeling pain starts when the trauma or cause of the pain occurs. This could be touching something hot, cutting yourself, having a blunt impact, or many other things. Next, response structures or receptors in our body send a signal through our nerves after the initial detection of the harm. The signal travels up the spinal cord and brainstem so it can enter the brain. The brain then understands that there is a need for pain, processes the information, and makes you feel pain. The thalamus is an area of the brain associated with these processes. However, there are others involved as well. This excerpt from Pain and How You Sense It illustrates this process well when stating, when we feel pain, such as when we touch a hot stove, sensory receptors in our skin send a message via nerve fibers, A delta fibers and C fibers, to the spinal cord and brainstem, and then onto the brain, where the sensation of pain is registered, the information is processed, and the pain is perceived. This quote shows the complexity of our bodies and makes you appreciate how quickly you are able to perceive pain. When it comes to pain tolerance specifically, it is less a system of intended biological processes and more of an adaptation. There are factors that are out of our control that influence pain tolerance, like age and even ethnic genetics, but at a base level, there are things that can occur to influence it. The article, Is Pain Tolerance Genetic?, puts it nicely, saying, pain tolerance is highly complex and involves the interplay of genetics, psychology, and cultural factors. Basically, pain tolerance comes about by affecting the response to the stimuli. All the factors mentioned in the quote can alter your mental reaction to pain, which can make your threshold for pain higher. This all just goes to show that the brain and its processes work wonders. We'll now look at some fields in which pain and pain tolerance are an important part of. We'll start with anesthesiology. Anesthesiology is the practice of giving medicine and administering care to ensure sleep or a lack of pain in a medical context. Obviously, this very important field relates to the subject at hand. Anesthesiologists really need to know what they are doing, as mishaps can be fatal with the medicine they are using. Also, if, for example, someone is undergoing surgery, an anesthesiologist must do their job right, because the person should not be able to feel the surgery or interrupt it in any way. The sensation of pain must not be present, either through a complete temporary tolerance or, usually, unconsciousness. The scholarly article, Anesthesiology and Pain Medicine, gives a deeper look into the job of anesthesiologists when saying, anesthesiologists have currently expanded their practice, formerly restricted to the operating room, to include perioperative medicine. The latter encompasses treatment of acute pain, postoperative and intensive care, in addition to chronic pain medicine, sleep medicine, and palliative care. This all goes to show that anesthesiology plays a key role in the medical domain. Another field concerning pain and pain tolerance is physiatry. Physiatry is the practice of treating a wide variety of medical issues, along with locating pain and assisting with the treatment of physically impairing conditions. Physiatry is focused on working with people to help them get through bodily problems they are having through physical analysis. There are a variety of ways physiatrists get their job done, and they can be seen in this quote from What is a Physiatrist and What Conditions Do They Treat, when it says, typical treatment may include therapeutic exercise, medications, and pain-relieving injections to improve function. This quote is essentially saying that physiatrists work to get their patients to feel relief and for their patients' bodies to work correctly without drastic surgical measures. Physiatrists are essential specialists in the sector of medicine dealing with musculoskeletal issues, and since these issues involve pain quite often, mentioning physiatry here was very relevant. The final field I will be discussing in relation to pain and pain tolerance is osteopathy. Osteopathy is a medical field concerned with helping the body work properly through tissue pressure and physical treatment. It is also concerned with overall health. Osteopaths can help relieve pain for their patients through massages and movement. This excerpt from Osteopathic Manipulation in the Management of Chronic Pain, Current Perspectives, states how osteopathy is effective, saying, osteopathic physicians in the United States are uniquely positioned to manage chronic pain because their professional philosophy embraces the biopsychosocial model, and they are trained in the use of osteopathic manipulative treatment, OMT, to complement conventional medical care. Although it may feel odd in the moment, lots of bodily manipulation makes patients end up with the ability to tolerate it and benefit in the long term. They can help people hurt less and restore function with their special care. They focus on the effect that the pain is having. This quote from Osteopathic Manipulation in the Management of Chronic Pain, Current Perspectives, describes this, saying, "These findings coincide with the biomechanical model of osteopathic medical practice and align with efforts to reduce pain impact rather than merely focusing on pain intensity." This quote goes along with the previous quote, which talked about how osteopathic care and treatments help with chronic pain. Overall, osteopathy is a helpful medical field that boosts the health of patients in the long term through addressing them physically and dealing with pain to help bodily function in the long run. That concludes this video on the original evolutionary reason for pain and pain tolerance, the biological processes behind pain, and fields that involve pain and pain tolerance. This also concludes this video series on my EIP question of what is the function and significance of pain tolerance. I know, especially in this video, that just the general topic of pain was addressed quite a bit rather than pain tolerance itself, but regardless, I hope that you found all the content I've produced with these videos to be informative and insightful in regards to the inquiry question. Thank you for watching.